It's Great Day Houston. From food, fun, health, family, in other words, your life. It's your morning wake-up call to everything Houston. And here's your host, Deborah Duncan.
Good morning, everybody, and thank you so much for joining us on Great Day. Thank you very much. Thank you. All right, I got to say good morning to Braden Duke. He's a little 4-year-old who was upset yesterday because the Parrots didn't win, and he likes parrots. You mean the Patriots? No, it's the Parrots. Anyway, thanks for joining us today. It is Medical Monday, and we invite you to participate on the show today from home. Email us a question at greatdayhouston@khou.com, and our panel of doctors will try to answer your health-related questions throughout the show. And those doctors include heart surgeon Dr. Michael Macris, orthopedic surgeon Dr. James Ghadially, and hormone expert Dr. Stephen Hotze. Please welcome them to the show this morning. Since the doctors are in, some of our audience members have some questions for them. So let's start right over here. Hello, ma'am.
Hi. I have a question about erectile dysfunction. Is it associated with a person with heart problems in men?
Well, it can be, particularly if the patient is taking some medication. So some blood pressure medication can cause that kind of problems, and some heart medication can have a side effect of that. But it's not uncommon for people that have heart disease to be older individuals, and men who have those problems tend to be older individuals, so they can be associated together, but not necessarily one causing the other.
All right, thank you. What's your question?
Hi, my question is, I hear that B12 complex is good for the heart. Is there any truth to that?
I'm not so sure that's a particularly heart therapy, B12. All the necessary vitamins are part of heart health, but that one in particular doesn't.
But what would vitamin B12 be good for? Because we hear a lot about it, and every time there's kind of like the vitamin or the popular vitamin of the month type thing that rolls around. So what would it be good for, and it's something that we do need to take or no?
B12 is good for production of red blood cells. So people that have low B12 counts, and this can be older individuals, get what is called pernicious anemia. They get anemic. So if you have low red blood cell count, you don't carry as much oxygen, you don't have as much energy. So in older individuals, it can be helpful if they have a problem with anemia that's due to a B12 deficiency.
All right. Hi there.
Hi. My question is, when I'm traveling and I'm driving for a long period of time, I have lower back pain. Is there anything you could do to alleviate that?
Well, first of all, you have to find out why you're having back pain. If you don't have anything intrinsically wrong with your spine, then you have to take a look at your car. Maybe you have an awful seat. Maybe you're driving a jalopy that should have been retired a long time ago. Or if it's not that, and that's very important to choose a vehicle that you're comfortable in for long distances, because different vehicles fit different people in a different manner. The chairs aren't ergometrically designed. You're going to have problems. And you can buy back supports that go in the car, but first of all, you need to make sure there's nothing wrong with your back, like a spondylolisthesis or other sort of instability.
Right.
My question is, when men are dealing with an imbalance in their hormones, what would you recommend in that particular area?
Well, men don't routinely have...
Wait, hold on, doctor. Okay, say that again.
My question is, when men are dealing with an imbalance with their hormones...
Say it again. Because my mom for years would say, I know they talk about menopause, but I know they go through it too.
Men don't have imbalance in their hormones. No.
Well, as a matter of fact, men don't really have an imbalance. They get a decline in their hormones, and the decline is in testosterone. You probably see a lot of ads about low T and all that, and it's been popularized, which I've been talking about for decades. Low testosterone levels. A man's testosterone, which is male hormone, which governs his initiative, assertiveness, sense of well-being, self-confidence, moods, goal orientation, drive, directedness, and decisiveness, all mental functions, besides all the other effects that testosterone has, peaks when a man's about 20 years old. When he's 40, it's half the level. When he's 50, it's a third of the level. When he's 60, it's a fourth of the level. So men tend to lose drive, their muscle tone goes down, their romantic moods and inclinations decline, and their abilities decline. So the secret is not Viagra. Nobody's born with low levels of Viagra. That's not the reason men have their problem. They need testosterone, for crying out loud, in a bucket, and that's what we give them.
Yeah, and there's a thing called andropause that we're hearing more and more about, too.
Andropause is the decline of male hormone.
Okay, so they do have a pause.
Sure, they have a pause.
Yeah. I'm just trying to support my mother on this one. She's been saying it for years.
Yeah, they have and very similar symptoms. Men, when they get into their 50s, late 40s and 50s, start having very similar symptoms that women have when it's very pronounced decline in their testosterone.
Because my dad's 94 now, so don't let him get a hold of some testosterone. Because
whatever, hey, if he's 94, whatever he's doing, he just needs to keep doing it.
Yeah, exactly. All right, we have some email questions also for our doctors. This first one's from David in Deer Park. He says, as she grew older, my mother developed scoliosis. Why does this happen, and is it preventable? And we see this a lot of times with old age, that they start to hunch over. So why does that happen, and is it preventable?
Well, there's two causes. First of all, there are those people who have a mild scoliosis, an idiopathic scoliosis, when they're young, and that may progress with age. More commonly, though, the hunching over, that's from osteopenia and osteoporosis, and that's either degenerative or loss of calcium. And going back to the vitamin questions earlier, taking vitamin D and calcium as soon as a woman's 30 at the very latest, to supplement that loss of calcium is crucial. And men also, we used to think that men didn't have to worry about it until they were senile in their 60s and 70s, but now we recommend calcium. now that we're almost 60, we recommend that men take calcium also to supplement and prevent that calcium loss in their bones.
Yeah, and vitamin D is one of those things that so many people are deficient in. You tell people to stay out of the sun, but it's added to things like milk, but if you don't drink milk, we see a lot of people just don't have enough vitamin D.
That's right. The ideal source, though, is the sun.
All right, let's go to our next email question for Dr. Macros. Should people without noticeable heart problems or symptoms get their hearts checked anyway? How often and at what age? This comes from Kristen in Pasadena.
Well, if you live in Pasadena, then you get poor air quality and you'd probably be at higher risk, which is a vague way of saying that everyone's testing for heart disease should be predicated on who they are. As a general rule, we say once you hit 50, then you really need to have at least a stress test or something. But, you know, if every male member in your family had a heart attack by the time they were 35, you might not want to wait till 50. You might not want to get there.
Well, and how many times do we hear, well, he was just jogging in the park one day and fell dead of a heart attack the next? So that should be kind of a routine thing on our list.
Yes, and certainly it all has to do with your family history, your personal habits. If you're a heavy smoking, hypertensive diabetic, you want to get checked a lot earlier in your 30s and 40s. And if you're someone who's got no heart disease at all in their family, they could easily wait till they're after 50. And if you have a normal stress test after 50 and you have low risk, it's unlikely. Or if no one in your family has ever had a heart attack before, it's also not as likely.
Yeah, and of course, you know, February is Heart Health Month, and you know, a lot of women are surprised to find that that is the #1 killer of women is heart disease. We think it's usually cancer, but it is heart disease. And again, thinking that there's no symptoms, and all of a sudden, so the key is if you feel anything at all, then definitely go in and get checked. But at a certain age, for sure, make it part of your annual physical routine. All right, our doctors are heading to the computers to answer your medical questions one-on-one. You can email your concerns to greatdayhouston@khou.com, and we'll try to get them answered through the show. But after the break, major surgery oftentimes comes with major scars. We'll get to the heart of the matter when it comes to a technique that diminishes the side effects of surgery.